we're going to match the correct word to fill in the blank. Okay. So first one, the nurse needs to check the patient's every 4 hours to track their basic health condition. We have oxygen saturation, heart rate, pulse oximeter, vital signs, or measure. So here we say the nurse needs to check the patient's every 4 hours to track their basic health condition. Olivia, which one do you think is the correct answer?
Vital signs.
Good, excellent. And can you read it, please, Olivia?
The nurse needs to check the patient's vital signs every 4 hours to track their basic health condition.
Excellent, excellent. Anna, do you agree with Olivia? Do you think this is correct or do you think it is incorrect?
It's correct.
It's correct. It is correct. Very good, Olivia. Very good, Anna. Excellent, excellent, excellent. Okay, the second one. To find out if the patient has a fever, remember fever, we first need to their body temperature. We have again oxygen saturation, heart rate, pulse oximeter, or measure. So I am going to go to Vanessa. Which one do you think it is? To find out if the patient has a fever, we first need to their body temperature. Which one do you think it is, Vanessa? So what would we do with body temperature? Would we heart rate the body temperature or would we measure the body temperature?
Measure.
Yes, perfect. Excellent. Vanessa, can you read it?
To find out if the patient has a fever, we first need to measure their body temperature.
Awesome. Awesome. Very, very good. Excellent. Okay. Next one, number 3. The patient's was 102 beats, beat per minute, which is slightly above the normal range. The patient's was 102 beats per minute, which is slightly above the normal range. Anna, which one is correct?
Heart rate.
Yes, very good. And can you read it, Anna?
The patient's heart rate was 102
and 2?
and
Yeah.
2 beats per minute, which is
Slightly
above the normal range.
Excellent. Slightly means just a little bit. Slightly. Good. Excellent reading, Anna. Very, very well done. Okay. Next one. Is a small device, a small machine that clips to your finger and shows your oxygen level and pulse. Is a small device that clips to your finger and shows your oxygen level and pulse. Leo, which one is the correct one? Oxygen saturation or pulse oximeter?
Oxygen saturation.
So oxygen saturation is in our
Yeah.
blood, right?
Yeah. Of push oximeter.
Exactly. That's the device. That's the name of the thing. Leo, have you ever used a pulse oximeter? Have you ever used it at the clinic, at your internship when you study? Do you use a pulse oximeter
Yeah.
or no? Yeah?
Yeah.
Yeah? Awesome. Awesome. Very good. Excellent. Excellent. Let's read the sentence, Leo.
Push oximeter is a small device
Device.
that tapes to your finger and shows your oxygen level and push.
Pulse. There. Perfect. We have to be careful because pulse is this, right? I want to hear L, S at the end. Pulse. Because push is this. I push something. Okay, so we have to be push is when I do this. Pulse is when I hear the S at the end. Okay, so we have to be careful. So this is pulse. Let's repeat once more. Leo, can you repeat once more? Pulse. Exactly. Yes. Very, very good. Awesome. Okay. And we've got one more. So back to Olivia. Olivia, can you do for us the last one because we know what the answer is?
The doctor is concerned because the patient's oxygen saturation was only 89%, which is too low.
Awesome reading. Excellent, Olivia. Very, very well done. Awesome, you guys. Really well done. Vanessa, Anna, Leo, and Olivia, any questions? You guys did very, very well with this. Excellent job, okay? We're going to continue on.